Hi and welcome to episode 3 of Verbal Physio with Dr. Sudarshan. Thank you so much for joining in, and I have 4 questions for you. The first question is, I have been taking supplements on a regular basis, and that's vitamin C. So is there a possibility that excess of vitamin C can cause knee pain? The second question is, I had a fall 1 week back and the doctor has advised me complete rest. Do you think I should also forego my fitness journey in this process? The third question is, I have a neck pain which constantly bothers me. Is there really a cure for neck pain? And the fourth question is from a physiotherapist who wants to know, I have been posting my content on most of the channels on social media, but that's too overwhelming. Is there an ideal way of doing this? Thank you so much for all your questions, but before we start, I would like to thank you and inform you that we have been getting more and more subscribers on our channel and other social media handles. So thank you so much for watching this show for liking this show. And in case you're watching this for the first time, I can help you in this manner. Whether you are a fitness freak or you're struggling with an injury, I can help you put up your answers by if you have any doubt regarding your journey in this whole process. Here is the link where you can put in your question, drsudarshan.co/question. You can put in your question in detail and I'll be more than happy to answer your question in the next or upcoming episodes. So thank you so much, and let's move on with the first question. So the first question for today's episode is from Elite Coelho. She wants to know, recently I noticed some kind of discomfort in my left kneecap. Nothing major and I'm able to do all my activities, but was wondering if this has anything to do with high uric acid or vitamin C, which I have been consuming daily as an immunity booster for the last few months. Your thoughts on this, please. Thank you so much for writing in, Coelho. Well, yes, knee pain is a probability. It's not essentially because of your higher dosage of vitamin C. Also, in case you have been taking a higher dose, the normal dosage is something between 65 to 90 milligrams. But in case if you're taking a higher dose, the side effects are essentially vomiting, nausea, and abdominal cramps. So knee pain will not happen because of vitamin C dosage. Regarding uric acid, if your uric acid is high, you should also have some joint pains at different other areas. Okay, but I would request you to check your uric acid levels if that's the case, and maybe you just need to have some more activities related to your knee. You can do some right stretches also, followed by your leg exercises day. And if you feel that there is a soreness around your kneecap area, if that happens while stepping down or while coming up, maybe a bit of icing will really help in the beginning. Since you're doing workouts, try and focus more on the specific knee muscles. And if you want to do a proper stretching session, you can also check my YouTube link where you have a completely detailed session on my lower leg stretches, which will help you to get a proper stretching regime for your knee. Make sure that it's very important for us to stretch our muscles. I've been always emphasizing about the component of stretching because that's where you get the complete recovery. Okay, so thank you so much for putting in this question. So the next question is from Vaidehi Ambure, and she wants to know, I had a bad fall 2 weeks back, consulted ortho, and he has given me some painkillers and some related medicine. I'll be doing a follow-up once again. Now my total exercise is stopped, even normal movement. Need your valuable suggestions. So thank you so much, Vaidehi, for writing in. And this is something which I have always seen between exercise versus injury, that whenever someone who's been working out on a regular basis, and if they suffer an injury, they try to get back to that exercise form as fast as possible, as soon as possible. And I don't think that's the right way of doing it, because if you have an injury, you need to respect it. You need to really undergo the medications prescribed by your doctor, or probably the exercises that are shown by your physio. Yes, rest itself is one of the most important aspect of therapy. Okay, that itself is a form of treatment which needs to be done, because if you are not resting properly, you're not allowing proper recovery to happen, and because of which, trying to just push it up with your exercise format or trying to get into your fitness regime as soon as possible will only give more opportunity for this injury to become all the more big. If it is a grade 1 tear or just probably just inflammation, it can potentially become a tear if you are trying to go a little fast on your fitness journey. So just make sure that you get that time, give it a proper amount of time. As long as you don't feel confident about it, I don't think it is advisable for you to get onto the exercise format as soon as possible. It's absolutely okay to rest, and it's absolutely okay to recover completely and then get onto your fitness journey. So the third question is from Anita Singh. And she says, I have been in a lot of pain due to cervical spondylitis. Physio gives me relief for some time, but because of my work, which requires sitting for long hours before the laptop, I am back to square one. I need a long term solution. Well, Anita, thank you so much for writing in. And yes, there is a long term solution. But even before giving you the solution, I would like to inform you and what is the perfect or probably the imperfect way in which we are using our neck throughout most of the activities. Well, if you really see, we are constantly surrounded by gadgets everywhere, whether it is a mobile, whether it is an iPhone, or whether it is an iPad, or even your screen time and laptops. And we have been constantly in a forward neck position. Now let me explain you what exactly am I talking about. Well, this is a normal posture of our neck. Okay, where normally if you are inclined and if you're in the right posture, the weight of the head is about 4 to 5 kgs. Okay, wherein even if you're moving 2 inches forward, which is a very very normal posture, which is a very very normal way of people carrying their posture, where their neck is a little ahead. Most of the people that I see, whether they're working on laptop and all kind of things, and even for that matter for housewives, they always have a forward head posture, which is, even if it is a 2 inches forward, this puts around about 14 kgs of more weight than your normal head weight. Okay, now imagine carrying that amount of weight and putting that amount of strain on your neck muscles. Now this is really creates a lot of spasm for your upper back areas, and further this can also lead to more severe postural problems, which can even lead to more weight on the neck area, almost up to 19 kgs of weight, which you can actually see in the neck area. Now imagine having so much of stress on the neck, and then if we say that this pain is bothering me, the key is actually in the posture. You need to take consistent rest between your work schedule. Okay, you need to constantly stretch your neck in all directions. Make sure that this area of the neck is really loosened up, by doing the right kind of stretches. You can check my YouTube channel where I have put up all the stretches related to neck, and I have shown in detail about every stretch and what exactly it does. So it's not that you need to live with the pain. Yes, physiotherapy is required as in when this becomes really severe, but ideally the key lies in the posture. If you have the right posture, if you take frequent amount of breaks, I think you will still sustain very well, and it should not be a very very serious problem. So just make sure you do this and take frequent breaks. The last and final question of the day is from a physiotherapist. Her name is Sarita Joshi, and she wants to know, being active on too many social sites and groups and frequently arranging events at the clinic like Joint Pain Month or Cerebral Palsy Day. So too much internet activity and alertness maybe feel a bit overwhelming and not sure if this is the right way of doing it. Well, thank you so much for writing in, Sarita. Yes, I understand this can actually become a little overwhelming, and in order to keep it right, what I feel is that you should ensure that you space out your events on a regular basis. Maybe your events, you can have it 45 days in a span of 45 days, and get a proper participation, get a proper good experience for all your participants when it comes to event. Also, don't forget to get a proper mileage of this event by posting it on social media and showing it to people what kind of activity you have done. Secondly, when it comes to social media, try to understand where exactly is your consumer or where exactly is your client. You have to identify that depending upon the kind of activity you do. So probably, if you think Facebook is the channel, probably you should just work strongly only at one platform in the beginning. Keep working on that particular platform, understand what are the needs, what works well over there, and probably just keep posting that kind of content. And once you create a good influence, only then you should shuffle to other medias. Otherwise, you should just stick to one place and keep building your influence there, because if you have your clients over there, you don't actually have to reach out to other platforms also. So I hope I answer your question here, Sarita. Thank you so much for asking in. And that brings us to the end of our episode 3. Thank you so much for all of you for watching this. And if you have your questions, once again, you can write in your questions on this link, which is drsudarshan.co/question. Put up a lot of questions and I'll be more than happy to answer it in the upcoming episodes. Thank you so much.